Good morning and welcome to your simulation day.
Each simulation day, participants begin with a pre-briefing session in order to help them feel prepared and to decrease their anxiety levels related to simulation. They watch a pre-briefing video which includes their overall objectives, a review of the confidentiality agreement they have signed, and a complete orientation to the environment and the equipment they will use. This orientation includes an overview of what the mannequins can and cannot do, what is located within each patient room, and an explanation of how to use the patient monitor. The video includes short demonstrations of how to access and document information in the Eehr, load and program an IV pump, and operate a medication dispensing machine. Participants have already gone through an Eehr orientation at the beginning of their first MedSurg course. Providing participants with this information in a consistent manner allows them to focus on the patients and on using the Eehr instead of wasting time trying to find supplies or fumble with operating equipment.
Miss Gay Riley. She's 83 years old.
Immediately prior to the start of each scenario, the facilitator reads the participants their objectives and an SBAR report to give them the appropriate background information. They are also told that the information from the SBAR is located as a note in their patient's Eehr if they need to refer back to it.
Hi, Mrs. Riley. My name's Nikki. This is Carolyn and Sarah. We're here to take care of you today. How are you doing today?
This particular scenario involves an elderly female who arrived in the emergency department 1 hour ago, complaining of a productive cough with chest pain. A chest x-ray was performed, however, the report and the results are not available yet. A sputum sample, blood work to include an arterial blood gas, has been sent for analysis, and the participants are awaiting the results. 1 to 2 participants will log into the educational electronic health record, while another participant begins the patient assessment.
Hemoglobin is 12.1.
How do they access the patient's chart? An access code is located on the dry erase board in the room where participants can join the DocuCare class. This DocuCare class will house all of the Eehr learning charts for simulation patients. Participants should notice the data in the Eehr, such as the blood work, the x-ray, the sputum sample, and the arterial blood gas, as well as vital signs.
Just going to take a quick listen to your lungs in the back. Take deep breaths.
It is here where the participants begin to make sense and interpret the data.
The CO2 is 32.
Participants should respond by contacting the healthcare provider
She's on
and give an
90%
SBAR
oxygen,
report.
Nasal cannula, 2 liters. Her respirations are.
The reason for calling the provider is to get additional orders for this patient's problem. If the SBAR is appropriate, the provider will give multiple telephone orders. It is important that the participants repeat these orders back to the provider for verification. If the SBAR is incomplete, the healthcare provider will ask the participant to call back. The timing for orders, lab results, radiology reports, etc. has been based on the average time it takes participants to notice and interpret information within each scenario. Several of the orders in the simulation are for medications. Participants are learning to use and access their clinical decision support tools. Some of these tools are Lippincott Desktop Advisor and the Davis Drug Guide app. They use these tools to look up medication information. Then the participants are ready to retrieve the medications from the medication dispensing machine. Participants will then use the medication administration record in the Eehr to implement the rights of medication administration. They will verify the right patient by scanning the barcode on the patient's arm. Next, they scan the barcode on the medication package to make sure they have the right medication, the right dose, the right route, and the right time. Finally, the participants save all documentation. It is now that the participants are ready to safely administer the medication.
As that's helping to clear out your infection. And
As participants perform interventions, they should be documenting these interventions in the EEHR. This includes any reassessment performed of the patient. Just note that the documentation may not occur until after appropriate interventions have been provided.
Is there anything else you need right now? Are you comfortable? Would you like to sit up a little bit more?
I could go down a little bit and take a nap.
Absolutely, Miss Riley.
If the patient asks a question, it should prompt participants to provide patient education regarding the patient problem. Then the scenario is complete.
Thank you. And sitting up a little bit, okay?
Every situation is different, right? You know.
Immediately following the end of the scenario, the participants and the debriefer, who in our program also happens to be the faculty member, subject matter expert, and the facilitator, participate in a debriefing session. This is done in a room separate from where the scenario took place and is a supportive, respectful, Socratic process.
What do I do next? I got to take care of the patient. I've got to, document.
The facilitator assists participants to conceptualize how what they learned can be applied to future clinical situations.